We discussed an interesting case we had in our hospital of a patient who had quite some challenges through the treatment and how it affected the outcome. Initially, during the staging scan, the patient had a locally advanced limited stage small cell cancer. There was some consideration of metastasis to the brain or not, which required further evaluation, which in a way added some delay to the treatment. Eventually, the patient had 2 cycles of chemotherapy sequentially before starting radiotherapy, and there were some complications during the chemotherapy as well, requiring hospital admission and some delays as well. After that, the scan following that showed very good response to treatment. Patient was started on durvalumab at the time, consolidative durvalumab at the time, but again had some toxicity that as well, which affected, which required the treatment to be stopped, and further scan showed evidence of progression and durvalumab was stopped altogether. I think the last thing which was quite interesting for this case, because it was 5 months from the last platinum-based chemotherapy, there was a consideration whether we re-challenge with platinum or not, so that's something else which is quite interesting about this case. Yes, I think there are a few lessons to learn. One of them is for patients who, in terms of trying to anticipate, like this patient, some trust to not routinely give like GCSF with carboplatin-based chemotherapy, but myelosuppression is one of the commonest side effects. So if that could be built into the protocol as well, that would have reduced the risk of having maybe neutropenic infection in this setting. Something else to mention as well is, in terms of, there was some mixed response in initial scan. Was that predictive whether the patient would have progressed eventually? Whether that, and would that also affect whether the decision to re-challenge with platinum-based chemotherapy in the future? So all of that are some of the considerations. And the last thing was regarding the pneumonitis the patient had. The pattern was very, very well from the scans, looked like radiation-induced pneumonitis. In this area where we give immunotherapy with a lot of our treatments, pneumonitis is a side effect from immunotherapy as well. How do we manage some of this added toxicity?